As of January 2026, several significant changes have taken effect in Florida's Medicaid program, alongside major federal policy shifts that are fundamentally reshaping healthcare coverage across the state. According to the Florida Agency for Healthcare Administration, the Kaiser Family Foundation, and the Florida Policy Institute, these developments are expected to affect millions of Florida residents in the coming months and years. Florida currently has the highest number of ACA marketplace enrollees in the entire United States, with approximately 4.7 million people purchasing health insurance through the federal exchange. At the same time, roughly 3.7 million Floridians are enrolled in Medicaid or the Children's Health Insurance Program. The intersection of state-level Medicaid adjustments and federal policy changes creates a situation that affects a substantial portion of the state's population. This video provides a factual overview of what changed, who is affected, and what the current status of these developments is, based on publicly available data and official sources. Starting January 1, 2026, Florida adjusted several Medicaid financial thresholds in line with the annual federal cost of living adjustment. The 2026 COLA increase was 2.8%, which is tied to changes in the supplemental security income rate set by the Social Security Administration. These adjustments apply specifically to long-term care Medicaid programs, which cover nursing home care, assisted living facilities, home and community-based services, and the program of all-inclusive care for the elderly, known as PACE. For individuals applying for long-term care Medicaid, the monthly income limit has increased from $2,901 in 2025 to $2,982 in 2026. For married couples where both spouses are applying, the combined monthly income limit is now $5,964. It is important to note that Florida is classified as an income cap state. This means that if a single applicant's gross monthly income exceeds $2,182 by even $1, they are technically ineligible for long-term care Medicaid unless corrective planning measures are used. The most common legal tool for addressing this is a qualified income trust, also known as a Miller Trust. This irrevocable trust allows applicants to redirect their excess income into the trust each month, thereby meeting the eligibility threshold. The trust requires that Florida's Medicaid agency be named as the remainder beneficiary, meaning that any funds left in the trust after the beneficiary's death are returned to the state. Setting up a Miller Trust requires legal assistance, and applicants are generally advised to work with an elder law attorney or a certified Medicaid planner to ensure the trust is properly structured and compliant with Florida law. The basic countable asset limit for a single Medicaid applicant has not changed and remains at $2,000. For married couples where both spouses are applying, the combined asset limit is $3,000. However, for the aged, blind, and disabled Medicaid program, the individual asset limit is $5,000 and the married couple limit is $6,000. Countable assets include cash, checking and savings accounts, money market accounts, stocks, bonds, certificates of deposit, investments, cryptocurrency, and real estate in which the applicant does not reside. Certain assets are excluded from the count, most notably the applicant's primary residence, under specific conditions. For single applicants, the home equity interest limit has increased to $752,000 as of January 1, 2026. Home equity interest is calculated as the value of the home minus any outstanding mortgage or debt against it. If a single applicant's home equity exceeds $752,000, the home is no longer exempt from the asset limit, and the applicant would need to take steps to reduce equity before qualifying. For married applicants, there is no cap on home equity value, provided that the applicant's spouse, a child under 21, or a blind or disabled child of any age resides in the home. If none of these family members live in the home, the applicant must demonstrate an intent to return to the residence. It is also important to note that while a primary home is generally exempt from Medicaid's asset limit during the applicant's lifetime, it is not exempt from Florida's Medicaid Estate Recovery Program. After a long-term care Medicaid beneficiary passes away, the state may seek reimbursement for the cost of care from the deceased's remaining estate, which can include the home. The Community Spouse Resource Allowance has been adjusted to $162,660 for 2026. This provision exists to prevent spousal impoverishment. When one spouse requires Medicaid for long-term care and the other spouse remains living in the community, the healthy spouse, referred to as the community spouse, is permitted to retain up to $162,660 of the couple's combined assets. The spouse applying for Medicaid may hold an additional $2,000 in assets. The maximum monthly maintenance needs allowance for the community spouse is now $4,067 per month. This figure includes a shelter standard of $794 per month for housing and utility costs. If the community spouse's housing and utility expenses exceed the shelter standard, the spousal income allowance may be increased, but it cannot exceed the $4,067 monthly maximum. These protections are critical for families where one spouse needs institutional or home-based care, as they allow the healthy spouse to maintain a basic standard of living without being forced into poverty. The Medicaid penalty divisor has increased to $10,645 for 2026. Florida's Medicaid program includes a 60-month look-back period that immediately precedes an applicant's nursing home or home and community-based services application date. During this period, Medicaid reviews whether any assets were gifted, transferred, or sold below fair market value. If such transfers are identified, Medicaid calculates a penalty period by dividing the total value of the transfers by the penalty divisor. For example, if an applicant gifted exactly $10,645 within the past 5 years, the resulting penalty would be 1 month of delayed coverage. If the total gifts were $53,225, the penalty would be 5 months. The penalty period begins not from the date of the gift, but from the date the applicant would otherwise have been eligible for Medicaid. The look-back rule applies only to nursing home and community-based services applicants. Regular Medicaid, also known as Meds-AD, does not have a look-back period. On July 4, 2025, the federal reconciliation bill known as the One Big Beautiful Bill Act, officially designated as H.R. 1, was signed into law. This legislation includes multiple provisions that directly and indirectly affect Medicaid programs across the country, with particularly significant implications for states like Florida that have not expanded Medicaid under the Affordable Care Act. While many of the law's provisions are set to take effect at varying points over the next several years, some changes have already begun affecting Floridians, or will do so in the near term. One of the most immediate impacts involves the enhanced premium tax credits for Affordable Care Act marketplace plans. These enhanced subsidies were first introduced under the American Rescue Plan Act in 2021 and subsequently extended through the Inflation Reduction Act through the end of 2025. During the period these subsidies were in effect, they significantly lowered premiums and expanded eligibility for millions of Americans, including approximately 4.7 million Floridians who purchased health insurance through the federal marketplace at healthcare.gov. The enhanced subsidies expired on December 31, 2025, and Congress did not extend them. As of January 2026, subsidy levels reverted to their pre-2021 American Rescue Plan levels. For many enrollees, this means substantially higher monthly premiums. Florida Blue, the state's Blue Cross Blue Shield affiliate, provided specific examples showing that a 40-year-old individual in Miami-Dade County earning $22,590 annually could see monthly premiums increase from $0 to $81 for the same plan. For individuals and families with higher incomes who previously qualified for subsidies under the enhanced rules, the impact is even more significant. Beginning in December 2026, Medicaid beneficiaries across the country will be required to renew their eligibility every 6 months instead of annually. This change doubles the frequency of the renewal process and requires beneficiaries to provide documentation more often to maintain their coverage. For individuals who have difficulty gathering paperwork, accessing the internet, or navigating bureaucratic processes, this increased frequency could lead to coverage gaps even among people who remain eligible. Starting in January 2027, retroactive Medicaid coverage will be reduced from 90 days to 2 months prior to the application date. Currently, when someone applies for Medicaid and is approved, Coverage can be applied retroactively to cover medical expenses incurred up to 90 days before the application was submitted. The reduction to 2 months means that individuals who delay applying could face uncovered medical costs during the gap period. Beginning in October 2028, non-exempt Medicaid beneficiaries may face out-of-pocket costs of up to $35 per visit for specialist services and procedures. Primary care visits and preventive services will remain free of charge under this provision. To understand the full significance of these changes, it is helpful to consider Florida's broader healthcare coverage landscape. Florida is currently one of 10 states that has not expanded Medicaid under the Affordable Care Act. Under the ACA, states were given the option to expand Medicaid eligibility to all adults aged 18 to 64, with household incomes at or below 138% of the federal poverty level, with the federal government covering 90% of the cost. Florida has declined to do so since the ACA's passage. Without Medicaid expansion, adult eligibility in Florida remains extremely limited. Parents with dependent children qualify for Medicaid only if their household income falls below approximately 26% of the federal poverty level, which translates to roughly $719 per month for a family. Adults aged 19 to 64 who do not have dependent children and who are not disabled, pregnant, or formerly in foster care do not qualify for Medicaid, regardless of how low their income is. This creates what is widely known as the coverage gap, a situation in which individuals earn too much to qualify for Medicaid under Florida's current rules, but too little to receive premium subsidies on the ACA marketplace. According to the most recent estimates, approximately 1.4 million adults in Florida fall into this coverage gap. Only Texas has a larger population in this category. The Kaiser Family Foundation projected that the combined impact of Medicaid restrictions under the One Big Beautiful Bill Act and the expiration of enhanced ACA subsidies would result in approximately 1.5 million Floridians losing their health insurance, with an estimated range of 1.1 million to 1.9 million. Of those 1.5 million, roughly 1.4 million, or 93%, are projected to lose coverage due to ACA marketplace changes rather than direct Medicaid cuts. The Wakely Consulting Group and Health Management Associates estimated that non-expansion states like Florida could see between 53% and 64% coverage loss among ACA marketplace participants. The Florida Policy Institute indicated that as a result of these combined changes, the state's uninsured rate could rise from a historic low of 10.7% in 2023 to approximately 16.7% beginning in 2026. Since 2015, Florida has had the highest number of individuals utilizing the ACA marketplace to gain health insurance, which means the state is disproportionately affected by any changes to the federal subsidy structure. In 2024, an organization called Florida Decides Healthcare launched a campaign to place a Medicaid expansion constitutional amendment on the November 2026 statewide ballot. The proposal would have required Florida to extend Medicaid coverage to adults aged 18 to 64 with incomes at or below 138% of the federal poverty level. The campaign collected hundreds of thousands of signatures and was supported by polling data showing 67% of Florida voters favored expansion, including 87% of Democrats, 67% of independents, and 52% of Republicans. However, in September 2025, the campaign announced it was suspending its 2026 ballot effort. The organization cited House Bill 1205, a sweeping petition law overhaul signed by Governor Ron DeSantis in May 2025, as the primary obstacle. According to Florida Decides Healthcare, HB 1205 increased petition verification fees by more than 3,000% in some counties, shortened the petition submission window from 30 days to 10, required petition circulators to be Florida residents and non-felons, limited each organization to supporting only one ballot initiative at a time, and created a $50,000 penalty for hiring out-of-state signature collectors. The organization needed approximately 880,062 valid petitions by February 1, 2026, to qualify for the ballot and concluded it could not meet that deadline under the new rules. Florida Decides Healthcare stated it would regroup and target the 2028 election instead, where a presidential election year turnout could work in their favor. The organization's legal challenge to HB 1205 continues in federal court, with a trial that was scheduled for January 2026. The Florida Policy Institute described the combined impact of ACA subsidy expiration and Medicaid restrictions as creating conditions for what it characterized as an impending healthcare coverage disaster in Florida. According to the organization's analysis, hospitals across the state could face an estimated $5.2 billion in uncompensated care costs as newly uninsured patients rely on emergency rooms for medical treatment. The Institute also estimated that by not expanding Medicaid, Florida is foregoing approximately $10.5 billion annually in federal matching funds that expansion would provide. The Florida AFL-CIO officially endorsed the Florida Decides Healthcare ballot initiative, stating that Medicaid expansion could provide coverage to millions of Floridians and potentially save an estimated 7,000 lives annually through improved access to preventive care and chronic disease management. The organization also argued that expansion would help keep rural hospitals open and reduce overall healthcare costs by shifting utilization from emergency rooms to primary care settings. Some state legislators have expressed opposition to Medicaid expansion. Representative Chase Tremont, whose district covers parts of Volusia and Brevard counties, stated that able-bodied adults without dependents should not be enrolled in the program, and that healthcare coverage for lower-income residents should be addressed by churches, nonprofits, and community clinics, rather than through expanded government programs. Bills supporting Medicaid expansion have been filed in the Florida legislature on multiple occasions over the past 15 years, but none have received a committee hearing in the House. The Florida Office of Insurance Regulation reported that approved health insurance premium increases for ACA-compliant individual and family plans in the state averaged a weighted 31.5% for 2026. 14 of the 18 insurers writing individual policies in Florida proposed double-digit rate increases. Molina Healthcare proposed the highest overall rate increase at approximately 41%, which could affect more than 90,000 policyholders. AmeriHealth Caritas requested the second highest increase at approximately 37%, affecting roughly 55,000 policyholders. Centene Venture Cumber Florida proposed the lowest increase at 18.73%. Though given its large enrollment base, the increase would affect an estimated 1.3 million individuals. The national median proposed increase across 312 insurers in all 50 states, and the District of Columbia was 18%, according to a review by the Kaiser Family Foundation, which was more than double the previous year's median of 7%. As of February 2026, the updated Medicaid income and asset thresholds are in effect statewide. The 6-month eligibility renewal requirement under the federal One Big Beautiful Bill Act is scheduled to begin in December 2026. The reduction of retroactive Medicaid coverage from 90 days to 2 months is set to take effect in January 2027. The new out-of-pocket cost provisions for specialist visits are planned for October 2028. The full scope of these changes will unfold gradually over the next several years. The 2026 Florida legislative session began on January 13th and is scheduled to run through March 13th. More than 1,200 bills have been filed, several of which are directly related to health care. Among the notable proposals is the healthcare reform package titled Florida's New Frontier in Healthcare, announced by House Speaker Daniel Perez. This package includes a bill proposing a full repeal of remaining Certificate of Need requirements for hospice programs, nursing homes, and intermediate care facilities, as well as expanded independent practice authority for advanced practice registered nurses. A companion bill, the Prescription Reduction Incentives and Competition Enhancement Act, designated as HB 697, targets pharmaceutical costs through measures including reference pricing based on international drug costs and reforms to pharmacy benefit manager practices. Senate Bill 1760, which addresses Medicaid oversight, PBM regulations, and managed care plan reporting requirements, was on the Health Policy Committee agenda as of early February 2026. Senate Bill 740, the Healthy Florida Act, proposes a comprehensive state health plan though its prospects for passage during this session remain unclear. The Medicaid expansion ballot effort has been suspended for the 2026 election cycle. Florida decides healthcare plans to resume petition gathering for the 2028 ballot. The organization's federal lawsuit challenging HB 1205 is ongoing. Independent analyses from KFF, the Urban Institute, and the Commonwealth Fund have projected substantial health coverage losses nationwide as a result of the combined policy changes, with Texas, Florida, and Georgia identified as the states facing the steepest impacts. The Commonwealth Fund estimated that total economic output could decrease by $57 billion nationally, and employment could decline by 286,000 jobs. At this stage, the full scope of how these combined state and federal changes will affect Florida's healthcare landscape remains to be determined, as many provisions take effect gradually over the next several years. What is clear from official data and independent analyses is that millions of Floridians are facing a period of significant transition in how they access and pay for healthcare coverage. The developments outlined in this video are based on publicly available reports from government agencies and independent research organizations. Further developments are expected as more information becomes available.